ठीक है, तो हम ये वाली डायग्राम जो है इसको डिस्कस कर रहे थे ना, तो इसको एक दफा फिर रिवाइज कर लेते हैं। तो ये देखें सारे स्टूडेंट्स, ये डायग्राम हम डिस्कस कर रहे थे, तो अब इसको हम यहाँ पे पिक्चर में इधर देख लेते हैं। ये देखें, दिस इज योर स्कैपुला बोन। ओके, this is the spine of the scapula, this is the acromion process. Okay, this is the supraspinatus fossa, infraspinatus fossa. ठीक है, अब ये देखिए यहाँ से ये मसल जो है इट इज गोइंग हेयर नाउ। दिस मसल इज teres minor muscle, and teres minor muscle, this is the teres major muscle। और यहाँ पे ये है जी ट्राइसेप्स का लॉन्ग हेड। नाउ इट इज मेकिंग हेयर वन quadrangular space, then one triangular space, and then there is this upper triangular space। okay, तो इन स्पेसिस से कुछ स्ट्रक्चर्स वगैरह पास हो रहे हैं विच इज वेरी इंपॉर्टेंट। फॉर एग्जांपल आपके जो है ये जो quadrangular space है ये वाला, from this quadrangular space, because it is near to your surgical neck of the humerus bone, so your axillary nerve is passing, and along with the axillary nerve your posterior circumflex humeral artery is passing। okay, so these two structures are passing from this quadrangular space. This is your lower triangular space, this is the upper triangular space. So this upper triangular space, what is passing? Your circumflex scapular vessels are passing। okay, circumflex scapular vessels are passing। now this is the important lower triangular space। okay, so this lower triangular space, what is passing? Because it is near to the shaft of the humerus bone, so your radial nerve is passing. Along with the radial nerve, your deep brachial artery is passing। okay, so your deep brachial artery is passing and radial nerve is passing। so these spaces and their contents are very important, okay, for your examination point of view। okay, तो अब इसका हम इधर कुछ पिक्चर जरा जो है एटलस में से देख लेते हैं। नाउ सी दिस पिक्चर नाउ, so this is your pectoralis minor muscle, see, and this pectoralis minor muscle, it is covered here by which fascia? Write down in the chat box, it is covered here by which fascia? Write down in the chat box, जल्दी से लिखें। very good। okay, so this is your this fascia which they are showing in the diagram, this is your clavipectoral fascia, this is your clavipectoral fascia, and now you can see here, this is the vein, this is your cephalic vein, and now it is coming out here, and now it is piercing the clavipectoral fascia, and this cephalic vein is draining where? It is draining into your axillary vein, okay, which other structures are piercing the clavipectoral fascia? Number one, your lateral pectoral nerve, ये जो येलो में यहाँ दिखाई हुई, दैट इज योर lateral pectoral nerve। artery, what is the name of the artery? Write down in the chat box, name of the artery, write down in the chat box, which is piercing the clavipectoral fascia। very good, that is your thoracoacromial artery, a thoracoacromial artery, which is a branch of your which artery? Write down in the chat box, that is your axillary artery। very good। okay, so this is your clavipectoral fascia, so see here, this is your pectoralis minor muscle। okay, and this pectoral minor muscle, you can see from the diagram, it is coming out from your third rib, fourth rib, and fifth rib, and all these muscle fibers are inserting into this process, this is your coracoid process। Okay, this is the coracoid process. So this is your which muscle? Pectoralis minor muscle. Okay, this is your pectoralis minor muscle, and this is the clavipectoral fascia. Okay, see here, यहाँ पे भी वो यही दिखा रहे हैं. See, this is your axillary vein, this is your axillary artery, and see here, this is the clavicle bone. This is the, इसको थोड़ा सा zoom कर लेते हैं. 1 second. Zoom in. Now see this diagram. अब सही ना, can you see it now properly? See here, this is the clavicle bone now. Okay, clavicle bone now. See here, this is the subclavius muscle. Subclavius muscle. This is your pectoralis minor muscle. Pectoralis minor muscle. Okay, and see here, this is your axillary vein. This is your axillary artery. Now axillary artery, तो यहाँ से जो ब्रांच पियर्स कर रही है क्लैवी पेक्टोरल फेशियो को, दैट इज योर thoracoacromial artery and cephalic vein. Okay, so they are piercing the clavipectoral fascia now. Okay, so this is how you can understand. This is your pectoralis major muscle. Pectoralis major muscle. Okay, pectoralis major muscle. Okay, this is your scapula bone. This one, this is your scapula bone. Supraspinatus muscle, infraspinatus muscle. This is your subscapularis muscle. Okay, this is your subscapularis muscle. So this is your orientation of your, or this is your section of the axilla. Okay, so by seeing this section, you can understand the borders of the axilla. Okay, so देखें, this is your whole parasagittal section of the axilla. So this axilla anterior border, अगर यहाँ पे लिखेंगे ना interior border, so this is the anterior border. So this anterior border of the axilla, it is formed by your which muscles? Pectoralis major muscle and pectoralis minor muscle. So these two muscles are forming your anterior border of the axilla. Okay, see here, this is the posterior border of the scapula. So posterior border of the scapula, posterior border of axilla. Posterior border of axilla. It is formed by which structure? See here, it is formed by your scapula bone. It is formed here by this muscle. What is the name of this muscle? Subscapularis muscle. And along with subscapularis muscle, there will be some part of teres major muscle also there. Teres major muscle. And see here, latissimus dorsi muscle is also there. So all these structures are making your what? They are making the posterior wall or posterior border of your axilla. Okay, axilla. Clear to everyone? And in this axilla, you have these contents now. So very important thing, see here. इसको मैं थोड़ा सा एक इसको remove कर रहा हूँ डायग्राम को यहाँ से ये. See here. In this axilla, this is the content of the axilla now. Okay. चलें इसके पहले 1 second. Now see here. This is the anterior wall of the axilla, which is formed by the pectoralis major muscle, pectoralis minor muscle. Posterior wall of the scapula, it is formed by the serratus. It is formed by the subscapularis muscle. It is formed here by the scapula bone. Okay. So this is the posterior border or posterior wall of the axilla. Now in the center here, see here, these are the axillary content. So please remember, very important point, that in the axillary contents or in the axilla, you have axillary sheet. And what is present in the axillary sheet? See here, I am drawing in the diagram. So axillary sheet, this is the axillary sheet now. Axillary sheet is having what? This artery is present. What is the name of this artery? That is your axillary artery. And in relation to axillary artery, these are the three cords of brachial plexus. Okay, brachial plexus, three cords. Okay, तो जो तीन cords हैं brachial plexus के, see here everyone, the lateral cord, the posterior cord, and the medial cord. All these three cords of the brachial plexus, they are in relation to your, they are in relation to your which artery? The answer is axillary artery. Okay, the answer is what? Axillary artery. So see here, if the brachial plexus cord is lateral to the axillary artery, उसको आप बोल दोगे lateral cord. If it is behind the axillary artery, it is known as the posterior cord. And if it is medial to the axillary artery, it is known as the medial cord. So these are the content of axillary sheath. But what is your MCQ? This is your MCQ. MCQ. So what is the MCQ? That axillary vein, it is not present in the axillary sheath. It is not present in the axillary sheath. Okay. So in axillary sheath, please remember, in axillary sheath, you have axillary artery and the medial, posterior and lateral cord of the brachial plexus. They are present in the axillary sheath. But see here, the axillary vein is outside the axillary sheath. Clear to everyone? This is clear to everyone. Now I show you one more picture of diagram of the axilla. Now see this picture now everyone. Boundaries of the axilla, the apex, the base, then there is the anterior, posterior, okay? So we must have to understand by this diagram. Now see this diagram all students. See here, this is your axilla now from above. So from above, see here, this is the anterior wall of the axilla. This is the posterior wall of the axilla. So anterior wall of the axilla, it is formed by pectoralis major muscle, pectoralis minor muscle. Posterior wall of the axilla, it is formed by your scapula bone. It is formed by the subscapularis muscle also. Along with subscapularis muscle, there here will be teres major muscle also. There will be latissimus dorsi muscle also. Now what are the medial and lateral borders? उस picture में हमें नहीं दिखाई दे रहे थे. So in this picture, we can easily visualize the medial and the lateral border. So see here, the medial border of the axilla, it is formed by your ribs and your serratus anterior muscle. Serratus anterior muscle. So serratus anterior muscle along with the ribs, upper four ribs, are going to form the medial border of the axilla. Lateral border of the axilla, it is formed by what? It is formed by the humerus bone. Okay, it is formed by the humerus bone. So this is the lateral wall or lateral border of your what? Humerus bone. Okay, so these are the boundaries of the axilla. Now we must have to draw this diagram ourselves. अब ये diagram आप खुद बनाते हैं. See here now all students. Okay, so see this one first of all. This is your scapula bone now. Okay, so this is scapula bone, and along with scapula bone here there is attachment of muscle. What is the name of this muscle? That is the subscapularis muscle. Subscapularis muscle. Here will be supraspinatus and infraspinatus muscle. Okay, so this is the subscapularis muscle. So subscapularis muscle along with the scapula, they are forming what? The posterior wall of axilla. Posterior wall of axilla. Okay, now see here, anterior wall of axilla. Anterior wall of axilla, it is formed here by this muscle. This is your which muscle? Pectoralis major muscle. Okay, pectoralis major muscle. And this pectoralis major muscle fibers here. This is your humerus bone now. Okay, so this is your which bone? Humerus bone. So in the humerus bone, see here everyone, you have 1, 2 and 3. It is going to insert into this lip. What is the name of this lip? Lateral lip of your which groove? Bicipital groove. Bicipital groove. Okay? Bicipital groove. Okay? This is your which? Lady. Here the lady will be going like this. What is the name of the lady here? The lady name is your what? Latissimus dorsi muscle. Latissimus dorsi muscle. Okay? And now here, this is the medial lip now. So from the medial lip, teres major muscle is coming out. So this is your which muscle? Teres major muscle. So this is your which bone? Humerus bone. Okay? Humerus bone. And this is your what? Bicipital groove. Floor of the bicipital groove. Okay? Floor of the bicipital groove. So see here. This is the lady. This is the one major. This is the second major. This is your pectoralis major muscle. Here you have your ribs now. Which ribs? Upper four ribs, which are making the medial wall of your axilla now. Okay? And from the upper four ribs, muscle fibers are coming out and now they are attaching to the scapula bone. Okay, ये upper four plus lower four भी हैं, तो total 8 से हैं. That is your which muscle? Serratus anterior muscle. Okay, serratus anterior muscle. Clear to everyone? Now here one more muscle is present. This is the anterior wall. Okay, so this is the anterior wall. This is the medial wall. So this is the medial wall. This is the posterior wall of the axilla. And this is the lateral wall of the axilla. Lateral wall of axilla. Okay, very important this one. This is the lateral wall of the axilla. Clear to everyone? Now see here. In the axilla, you have axillary artery. So what is this? This is your axillary artery. And in relation to this axillary artery, you have the cords of brachial plexus. 1, 2, and 3 cords of brachial plexus. So these are your what? These 3 are your medial, lateral, and posterior cord of brachial plexus, which is present in the axilla. And all these cords of brachial plexus, medial, lateral, and posterior cord of brachial plexus, along with the axillary artery, it is present here in a sheet. This is known as what? Axillary sheet. This is your axillary sheet now. Okay? But see here, very important MCQ, which they are going to ask you. Where is your axillary vein? Write down in the chat box. It is in the axillary sheet. Axillary vein is where? It is not in the axillary sheet. It is outside the axillary sheet. Okay? So this is how you can understand. Yes, very good. This is how you can understand your what? Axilla. Very important topic of your what? Your anatomy upper limb. Okay, so see here. Medial cord will form ulnar nerve. Lateral cord will form musculocutaneous nerve. I will explain you brachial plexus. No need to worry. Posterior cord will continue as the radial nerve. Okay. So see here, main nerves of the upper limb, radial nerve, ulnar nerve, musculocutaneous nerve, along with there is also median nerve also. Okay. So these nerves are continuation of these cords. Okay. So they can ask you, posterior cord is a continuation which nerve? That is your radial nerve. Lateral cord will continue as which nerve? Your answer will be musculocutaneous nerve. They can ask you, uh, medial cord, it is going to continue at which nerve? Your answer will be the ulnar nerve. Okay? Clear to everyone? This is clear? This is clear to everyone? Very good. Okay. Yes, sir. Okay, 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 okay. Okay. Now see here. This is your serratus anterior muscle. See, this is the long thoracic nerve. Okay. This is your long thoracic nerve. So serratus anterior muscle, it is innervated by which nerve? Write down in the chat box. Write down in the chat box. Long thoracic nerve. Very good. And if this nerve is going to damage, what will happen in the patient? Write down in the chat box. Winging of scapula. Very good. So it will lead to the winging of scapula. This nerve is also known as what? Muscle is known as boxer nerve, but this nerve is also known as what? Write down in the chat. Nerve of Bell. Very good. Okay. Very good. Now see here. This is the quadrangular space. Nerve of Bell. Very good. Very good. Very good. See here, everyone. See? Now, see here. This is the quadrangular space. So from the quadrangular space, what is passing? Radial nerve is passing. No, no, no. Quadrangular space, not radial nerve. From quadrangular space, your passing is what? From quadrangular space, your what is passing? Write down in the chat box. Axillary nerve is passing. Yes. Okay. Axillary nerve is passing. And along with axillary nerve, what is passing? Posterior circumflex humeral artery is passing. Okay. Posterior circumflex humeral artery is passing. From lower triangular space. Yes. From lower triangular space, what is passing? Triangular space, what is passing? Your radial nerve is passing. This one. This is your radial nerve. It is passing through the lower triangular space. And along with it, what is passing? Deep brachial artery is passing. Deep brachial artery is passing. From upper triangular space, what is passing? Your circumflex scapular artery or vessels are passing. Okay. So these are your important MCQs which you must have to remember. Okay. Deep brachial artery is passing. Good. 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 Okay. So see here now. See here. This is the quadrangular space now. So from quadrangular space, what is passing? Axillary nerve is passing and posterior circumflex humeral artery is passing. See, it is in close relation to the surgical neck of the humerus bone. Please write down in the chat box. Axillary nerve is innervating which two muscles? Write down in the chat box. Axillary nerve is innervating which two muscles? Deltoid 1, second. Second. Very good. Deltoid muscle and teres minor muscle. Very good. Very good. Now see here. This is your lower triangular space. This is upper triangular space. From this upper triangular space, your circumflex scapular artery is passing. From your lower triangular space, your deep brachial artery is passing and radial nerve is passing. Okay? Radial nerve is passing. Write down in the chat box. Radial nerve is coming out from which cord? Radial nerve is coming out from which cord? Write down in the chat box. Very good. This is your posterior cord. Very good. Posterior cord. Okay? Good. Very good. Okay? Arteries, we will study it later. Okay? So this is your today's topic. I hope it is clear to all of you.